VLDL is made in the liver. Good. All right. So what will happen to VLDL and chylomicron? What happens to them as they secrete throughout the body? What happens to them? So they are delivering. So all those triglycerides are going to be delivering. Some tissues that need triglyceride will be removing, right? Triglyceride. We're going to be breaking down some of the triglyceride they contain, right, by what lipoprotein lipase, which is in the capillaries, correct? So what happens to those molecules? The triglyceride content will be decreasing, and what happens to cholesterol content? It's going to be increasing. So onto their size will be decreasing, but they will become heavier and heavier. So that's why we now have, they now become what, VLDL, VLDL now become what, ideal, intermediate density. And then if we keep breaking it, that will become what, LDL, finally. So ideal LDL, they are mostly what, cholesterol. And chylomicron becomes what, chylomicron remnants. It's also going to be mostly, right, cholesterol, right? Make sense? And it's important to note that because if an examiner doesn't tell me that somebody have hypertriglyceridemia, but the examiner tells you instead that a patient has high VLDL in their blood or high chylomicron in their blood, you should be able to infer that that means that what triglyceride is high, not cholesterol. And the examiner is telling me that IDL is high, LDL is high, or chylomicron remnants are high in the blood, then I should be able to infer that that means what the patient has hypercholesterolemia, not hyperlipidemia, and not hypertriglyceridemia. Yeah, good. Yeah, and then, right, because now if I want to divide, so for clinical application now, I can divide my lipid-lowering drugs into drugs that primarily do what? Primarily lower triglyceride, drugs that primarily lower cholesterol, or drugs that do both. Yeah, but right, although there are some that do both, but majorly most lipid-lowering drugs they're either partial, right, towards triglyceride or towards cholesterol. So which means if I ask you now, what would be the central, like we're not specific here, we're not going specifically here, we still just want to understand the principle. Based on the molecules we know that are the major players, right? Major lipids in the blood. How will I primarily or generally speaking, lower triglyceride in the blood? I can do this. So you know, you're going to be thinking, I can do two things, or maybe two major things. The first thing is prevent synthesis of what? VLDL or chylomicron. That's one. Two, increase what? The breakdown of VLDL and chylomicron. Does that make sense? Yeah. So inhibit their synthesis or increase their what? Breakdown. And then if I'm asking myself, how will I lower cholesterol in the blood? Simple, right? Increase the uptake, right, or removal of LDL, HDL from the blood, and cholesterol level goes down.